let's pick up from the last video where we left off and get right into sinusitis. Okay, again, it's sinuses, as in the sinuses over here, and itis, of course, inflammation of. Hopefully you're familiar with this because of the pre-module assignment that you already did. But let's see what we have here, okay? Well, I don't think there's anything really that new on here. I think most people are pretty familiar with the signs and symptoms of sinusitis. Of course, you have the congestion in the nose, right? You have the discharge. That's why you blow your nose and have tissues. If it's bad enough, you get the loss of smell. That makes sense. And fever, right? So usually there's a reason that you have sinusitis, so that's why you get a fever, because it's some kind of infection probably, or even allergies give you a little bit of a fever depending on what the cause is. Okay, headache, pressure. We already talked about sinus headaches, right? So you'd get that pressure, and that's just because, as you see, this mucus over here builds up, and as that mucus builds up, it takes up space in there, and it causes pressure, and that hurts. You can feel it. You can feel it if you press, on your sinuses when they're really bad, and it's tender because they're filled up. Okay, again, part of the whole whatever reason that you're getting this buildup of mucus in here. If you remember your anatomy back in the back of the nose here, you do have a hole back there, and you get the drippage from these sinuses. They drain out of the sinuses, and while you're sleeping, especially like if you're sleeping on your back because it's hard to breathe, then you get that dripping of this fluid that they call it a post-nasal drip, as in it drips behind the nose while you're sleeping, and that little droplets will sit there and they'll hit the back of your throat while you're sleeping, and doink, 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 and that can actually cause your throat to hurt. So you would get that, and of course I already talked about the pain over the sinuses. All right, causes of sinusitis, of course, the common cold, right? Your virus, your rhinovirus. Allergies is, of course, a cause of getting your sinuses all stuffed up. We know this. I don't think this is anything new. And then you've got your deviated septum, which I think the concept is probably not too hard, where you have this perpendicular plate, right? And that perpendicular plate is supposed to be, not that I can draw straight, but it's supposed to be more or less straight. Well, if you have a deviated septum, that perpendicular plate, that septum, and it goes out and it kind of infringes into one of the nasal cavities like that, then the airflow that's supposed to be coming in gets cut off. And if that gets cut off right there, well, now you're not getting the airflow back and forth, and both in front of it and behind it, you can get bacteria build up, and of course that can lead back to your colds, or not even cold, but bacteria, viruses, fungi, whatever can build up back there, and they can cause sinusitis. That hopefully makes sense. Treatment, well, as in with most treatments, you always start with the least invasive, the cheapest, the easiest to start with, and see if that works. So, of course, you would just take one of those warm, moist washcloths and put it over the face, and hopefully the heat and moisture from that will break the sinuses up and clear it out that way, if that's what you're trying to treat. Obviously, if it's from some kind of infection, then you treat that also, which is the antibiotics part down here. Drink plenty of fluids. The more liquid water that you can get in your body, the more chance that you can thin out that mucus. Okay, you have nasal sprays like Afrin or something like that that will actually shrink the arteries, or shrink the blood vessels, I guess, that are feeding into this nose. And if you shrink those blood vessels, then it's going to decrease the amount of liquid that is able to seep into your sinuses and that sort of thing. Okay, and of course, if it's a nasal septum, then they can go in and they can straighten that nasal septum back out to how it should be, let the air flow a lot easier. Transillumination that you see here is just a way to look at the sinuses. So if this is your sinus up here, and you have this little, basically it's a light, it's kind of like a flashlight, and they stick it in there, and and look and see, and you can tell if there's something in there filling up that cavity by just kind of looking at it. You guys have done that before, right? Or seen somebody do it where they put a flashlight in their mouth and kind of glows. Well, it's the same kind of thing, but from the other way. Okay, let's move on to meningitis. That's a little more interesting. Meningitis, okay, first off, we have to get oriented about, we know it is a inflammation of, because it's itis, a inflammation of the meninges in this case. So what are the meninges? Okay, well, these are the normal meninges over here, and it's the pia mater, arachnoid mater, and dura mater. If you look at it, it makes a pad on the outside of the brain before it gets to the skull. So you got your really hard skull right here, and you got your brain here, and of course going in. Well, the pad, or the pia mater right along the brain, the arachnoid mater, the space next to it, and then the tough outer layer, the dura mater, is that pad. You can see there's virtual spaces, or very small spaces in between each of these layers. The dura mater is the toughest layer of them all, and it's on the outside. And then the arachnoid, a lot of blood vessels in here, so when you have like a subarachnoid hemorrhage, that's pretty serious with all the blood vessels in there. And then the pia mater, not much really gets in between that and the brain. It's more of a shiny, really tight little sheath that goes over there, kind of like a plastic wrap or saran wrap kind of thing. Anyway, so those are your normal meninges. Okay, now thinking about them in relation to where they are in the brain, you can see if you have an inflammation of these, then it's going to, you know, if any of these things, or all of them, decide to get thicker, then there's only so much space in here, in this space. So what you have to do is they have to go somewhere where they're not going that way, towards the brain, I mean towards the cranium, because that's a really hard bone. It's not going anywhere. Only option is to go this way towards the brain, and as you do that, it's going to have to push the brain down, and the last thing you need is to actually start pushing your brain. That's the same kind of problem you have with your hematomas, right? So you kind of get the same kind of idea there, but also you got to remember that there's cerebrospinal fluid flowing through here. Okay, so that cerebrospinal fluid goes all the way down around the entire brain, and it also goes down the brain stem if you had the brain stem, so it goes down your spinal cord and everything too. Well, you kind of compress that, then it builds up the pressure in the spinal cord and in the brain, and that's obviously dangerous, again, for the same reason of pushing on the brain and everything. So you can see where they get a little thicker in there. Okay, let's talk about them. Most cases of meningitis are either bacterial or viral. You see the viral, it seems to me, I actually didn't look up the stats on this recently, but it seems to me that you see a lot more viral, although I'm not positive about that, so don't quote me. I'm pretty sure your book does say which is more common out of the two. But the viral is the one that, you know, you have a lot of little outbreaks in schools and that sort of thing, and they send home a letter and tell you, and you know, you got to keep that in mind. That one is less serious of the two, typically. So you're viral. The bacterial meningitis, that's the one that can cause some serious damage, where you get a seriously high fever, and you know, people can get brain damage that's permanent out of that. One other thing that is not really listed here is fungal. Okay, currently we are making this video in October of 2012, and there's a outbreak, I believe in the Midwest, about all of the about a fungal meningitis, because people were getting, I think it was a steroid injection, something like that, and it was the batch of the medicine was infected with a fungus, and people are getting fungal meningitis from that in an outbreak, and I think like 4 people or so have died, and there's many getting infected with this. So again, even though, you know, one might be more common than the other, you can get it from pretty much all of them. And that's actually true for encephalitis too. Encephalitis is, again, it's an inflammation, but it's in the entire encephalon as in the gray matter of the brain. Okay, so where meningitis is the meninges, the encephalitis is your actual gray matter of your brain, which is, you know, the main part of your brain, right? Okay, so how do you get these? Well, since they're bacterial, viral, fungal, then it's just like tuberculosis, isn't it? Crowded living quarters, dorms, barracks. I mean, you see that in any diseases, honestly, that are transmitted by air or fluids, any kind of crowded living quarters. So that's not necessarily something you need to memorize, but it's, you know. Anyway, basilar skull fractures, as in skull fractures towards the base of the skull. This is kind of a duh. I mean, if you crack open that cranium, then you allow a potential hole for any kind of pathogen to get in there. So of course that would be a problem, right? Normally you're pretty good with the blood-brain barrier and keeping things out, but of course if you crack the bone and you get a direct exposure to outside, sure. Same kind of thing here. If you have itis, okay, the otoitis, as in inner ear or medial ear, I guess, mid-ear. So if you have an ear infection and you know you're busting the tympanic membrane or something and you're introducing it into the brain through the ear, okay, again, sinusitis is from the last slide. Inflammation of the sinuses. The sinuses are basically cavities that go throughout the brain or the skull, and you could introduce it that way. Mastoiditis, if you remember your anatomy at all, the mastoid process is that, not that I can draw this, but okay, here's where you're going to find out exactly how horrible an artist I am. That's my dude right there, and he's looking forward. He's got a really big nose, apparently. Anyway, the mastoid process is this little process, a little bump right behind the ear. Okay, so that's my ear. I don't know where my bump went. It's right there. But the mastoid process is that little bump right behind the ear. Well, if that gets inflamed, then again, it could possibly lead to going inside of there and infecting the brain, whether it's the meninges or the actual brain. And systemic sepsis, that's, you know, sepsis or a really, really bad infection. And when they say systemic, what they mean is it went through the entire system. So that has gone somehow into the bloodstream. That's my artery. And as it's in the bloodstream, it's going to go to all over the place, your entire system, okay, your entire body. So that's what systemic sepsis is, of course. Even though we have a blood-brain barrier, anything that gets septic or a bad infection that leads to, that goes everywhere in your body, has the potential to end up there too, okay? Signs and symptoms, again, these are signs and symptoms and these are risk factors of both, right? Meningitis and encephalitis. So keep in mind, other than the actual definition, we really haven't said much differently, have we, between meningitis and encephalitis. These are all the same. Makes it very hard to tell them apart when you're talking about a case study or a test question, isn't it? Both of them you're going to get fever. Both are going to get headache. Both you would get photophobia, as in a problem with bright lights, right? You really can't really look at the bright lights. Where else have you seen photophobia? Things like migraines, right? Wow, that's really bad handwriting. But anyway, so things like migraines, you saw photophobia. Okay, irritability. I'd probably have to think about that mechanism for a bit, but I'm just going to go with the fact that your brain is infected or meninges around your brain are infected. Okay, along with that whole brain infection kind of thing going on here, you're going to get cloudy. It's not cloudy so much as, I don't know, you're a little less conscious, a little less aware than you should be. Obviously, that also is connected with fever. If you get too high of a fever, you're going to start doing that too. Okay? And neck stiffness. Okay? Notice it's for both of them because encephalitis is the brain swelling up and the meningitis is the meninges swelling up. In either case, it's going to cause that cerebral spinal fluid to be pressurized. okay, something's pushing where it's pushing on this channels, whether it's the brain coming out or the meninges coming in. The cerebrospinal fluid is flowing through those in between on the outside of the brain and the inside of the skull, and as you push things in or out, it's going to cause that. Well, that's why you get a stiff neck, and they call it nuchal, like the nuchal region is the back of the neck, so you get a rigid back of the neck. Okay, but again, it's in both of them. Milder symptoms and viral, which is pretty typical, and usually self-limiting, as in it usually will take care of itself when you're talking about viral. Okay, when you have meningococcal meningitis, then now we're talking about a petechial rash. So that's a little bit different, right? Now, having said that, a petechial rash is just really, petechia are a bunch of little kind of like broken blood vessel kind of things. So it just kind of a red dotty spotty rash as far as that goes. So you can get that for actually a lot of different reasons, but this is like the first thing that we really saw is with meningitis you get that petechial rash as opposed to encephalitis. Okay, so that's so far really the only thing that was really different, isn't it? Okay, how we tell? Well, we kind of have to do a culture of that cerebrospinal fluid to really know. So you go ahead and you stick a needle in that, you get some cerebrospinal fluid out of there and test it. Okay, well, even before you test it, if it is a bacterial infection, that bacteria is going to make that cerebrospinal fluid, which is normally clear, cloudy. Okay, also, well, that's really the only thing you can tell at first, and then you send it off to the lab. All right, now if you go ahead and send it off to the lab, you will see that you have a few things that are a little bit different. Okay, well, what's that? Increased neutrophil counts, which are leukocytes, by the way. Neutrophils are a kind of leukocytes, right? So the neutrophils specifically are more related to bacterias. Okay, so they're going to be increased. Protein levels, whether it's viral or bacterial, is going to be elevated, so that really doesn't help you a whole lot. But with bacteria, you get decreased glucose levels, so you get less sugar, okay, in that cerebrospinal fluid. And I like to think about it is if you have a bacteria, then the bacteria is actually eating the sugar, and therefore you have less glucose levels, okay? As opposed to viruses, they aren't going to eat that sugar. Alrighty, so that's pretty much it to tell the difference between the viral and bacterial. Again, you'll see it on the labs more than anything. And I think, let me look here. I want to go here and jump back if I have to. Yeah, okay. That's what I'm going to do. Because the encephalitis, even though any of them can be, you know, the meningitis or encephalitis can be from either, this does tend to be a little more virally related as opposed to the meningitis, even though you definitely get both. So that's, again, a little bit of a help there. Let's kind of look at this thing right here. What do we got here? We got a Kernig's sign. All right, so a Kernig's sign, you think about what this Kernig's sign is. What you're trying to do is you're trying to take that leg, and right now it's, you know, at this angle, but if you try to straighten it out and make it straight up, that's going to put pressure on the muscles, and it's going to transfer that pressure back into the spinal cord. Well, the spinal cord, since it's inflamed and it's already high pressure with the CSF and everything, that pressure transfer back into there is going to make it so even though there's no CSF obviously going through your legs, that pressure that it does when it straightens your legs out is going to hit that spinal cord and make it extremely difficult to straighten that leg out. Okay? It's more of a physiology thing than any other thing at that point. Okay? okay? And it hurts like crazy because as you straighten that leg out and put that pressure back on there, it transfers the pressure back into the spinal cord, and that's going to hurt a lot with that pressure even building up higher, okay? So that's called Koenig's sign to do that. And irritates inflammation just simply means that because of that inflammation, it hurts. It irritates it. It hurts. That's what we're talking about. Okay. This is our meningococcal meningitis. Okay, and there's our petechial rash. See how it's just basically just a bunch of little spots everywhere, little dots. Okay, so that again, you can get petechial rashes other places, but that's actually a pretty good place to start. You know, when you're talking about trying to tell the difference between encephalitis and meningitis before, like, your CT scan comes back, because obviously if you do a CT scan, you're going to be able to tell which is inflamed, whether it's the brain itself or whether it's the meninges. Okay, so here we're going to a little more detail on encephalitis. Like I said already, the encephalitis is more commonly viral, so that is a good hint. Not necessarily, diagnostic certainly, but it's a good hint. Okay, signs and symptoms, they can be mild to severe, fever, headache, increased intracranial pressure, which is what we've been talking about the whole time. ICP is intracranial pressure, or pressure inside the head. The stiff neck, again, just like in meningitis. The photophobia, just like it. And it can progress to seizure. Actually, both of them can progress to seizure because you're increasing your intracranial pressure, and anytime you do that, you're pressing on brain tissue, and it could actually seize up on you. So that, again, not necessarily helpful telling apart encephalitis or meningitis. Okay, and then I don't know how you can tell, but that's apparently swelling throughout the brain in this picture. That's more swollen than before, not that you saw before. Okay, moving on to temporal arteritis. We will do on the next video, because I want to keep these fairly short, around 20-22 minutes or so, because it's really a pain to try to load these things up if they get any longer than that. See you in a minute.